Hi everyone, welcome back. Today I'm excited to introduce a special guest joining us, Miss Edwina. She's an incredible leader in the world of medicine with the drive to improve society. Her dedication and passion to her field is admirable, and I can't wait to learn from her experiences. Can you start off by telling me about your career and sharing some experiences you've had?
Yes, sure. First of all, I want to thank you for having me on, Anushka. It's great to be on your podcast here. I am going to try to simplify this as much as I can. Please feel free to ask any questions or clarification as we go along. So I will introduce myself first. Obviously, my name is Edwina, and I was a trauma flight nurse for most of my career, which basically means that I was a specialized team in the medical field that was trained to transport critically ill patients via a helicopter, mostly, but although there's airplanes. And I basically did that for most of my career, which was really an honor. And for example, if there is a patient that is involved in a motor vehicle accident, they might dispatch us out to the location to stabilize the patient, give them advanced life support, and transport them to a level one trauma facility or hospital, if you will, so that they can get the advanced care that they need in order to survive their critical injuries. So that's basically what I did. I was part of a fabulous team that we worked very, very well together. And we also have or required to take lots of advanced training and advanced life support. And we also take part of working in the hospital at the trauma level one uh, facility as well. So we not only do we work at the hospital, we are also part of the flight team that gets transported out.
What do you think is the most rewarding aspect of your work, and how do you stay motivated despite the challenges of trauma nursing?
Wow. Well, obviously, I think everybody would agree that the most rewarding part of my career is knowing that the patient survived. That's really the most rewarding part, right? That we did what we could, we stabilized them, but at the end of the day, their destination, which is the hospital that is equipped to take care of them, takes over, and that they survive. That is the most rewarding part of it. I would say too that you have to be realistic in this career. You want to know that you did the best that you could and realize that not everyone is going to be a successful transport, and that's difficult to overcome. That is a major challenge because you feel like, what could I have done? But when you go in there and you overcome it by doing exactly what you were taught to do, acting quickly and proficiently, then you know that sometimes you just can't do, you don't get the outcome that you wanted, and that's disappointing. Now, there's so many factors to overcoming the stresses that come from this high, fast-paced, high-stress job. And I would say that overcoming them is vital because you have to go in there with a clear mind, a level head, and ready to perform. And that just doesn't come with just your training, your advanced skills. It comes with your lifestyle as well. I mean, how can you save somebody? How can you help somebody if you can't take care of yourself? Correct. So I would say part of that is a balanced life, making sure that you have a healthy lifestyle, you get your rest, and you do what you need to do to be healthy yourself so that you can help others. That's basically the advice that I would say I would give to anybody that is facing these critically care injuries, critically care patients, and going in there realizing that you want to be real and how do you overcome this realistic effects, and that's my advice.